MariTide could turn obesity treatment into a monthly shot, but it has not replaced Wegovy or Zepbound. In a Phase 2 trial, some groups lost about 20% of body weight after 52 weeks. The real test is not simply weekly versus monthly, it is how much weight people lose, how sick they feel, how long benefits last, and whether larger trials confirm them. MariTide, maridebart, cafraglutide, combines two actions inside one long-lasting molecule. It activates the glucagon-like peptide-1 receptor, a cell target that helps reduce hunger and food intake. It also blocks the receptor for glucose-dependent insulinotropic polypeptide, or GIP, a gut hormone involved in appetite and fat storage. An antibody backbone keeps MariTide active in the blood for weeks, supporting monthly dosing. That long stay may also allow wider gaps during weight maintenance. It changes duration, not the two-part mechanism described above. That design differs from Wegovy, semaglutide, which activates only the GLP-1 receptor. Zepbound, tirzepatide, activates both GLP-1 and GIP receptors. MariTide activates one pathway while blocking the other, so its two-signal strategy differs from both approved drugs. Blocking GIP looks contradictory because Zepbound activates the same receptor and still causes major weight loss. Scientists do not yet know why turning the GIP receptor on or off may work. Trial results matter more than predictions from receptor actions. The Phase 2 study included adults with obesity or overweight, with and without type 2 diabetes. Participants received monthly doses, an every 8-week schedule, or placebo, an inactive injection. Researchers also tested whether starting lower and increasing slowly reduced side effects. Among participants without diabetes who stayed on treatment, the strongest group lost nearly 20% of starting weight by week 52. Placebo produced about 3% average loss. For a 250-pound person, 20% represents roughly 50 pounds. That 20% figure came from an efficacy analysis, which estimates results while people remain on assigned treatment. A broader analysis counted people who stopped or changed treatment and found smaller losses. Real-world expectations should consider both views. Participants with type 2 diabetes lost less, as commonly happens with obesity medicines. The strongest average result approached 17%, compared with about 1% on placebo. Their A1C, the 3-month blood sugar average, also fell, showing benefit beyond weight loss. Weight loss had not clearly leveled off by week 52. That does not guarantee continued loss after the trial. It means the average weight curve was still moving downward when the formal first-year analysis ended. These results put MariTide among the most powerful obesity drugs being studied. Wegovy produced about 15% average loss in its major obesity trial. Zepbound reached roughly 21% at its highest dose, but separate trials cannot prove which drug is stronger. The comparison becomes less certain because trial rules differ. Starting weights, diabetes status, dose schedules, and lifestyle programs affect the final percentage. Results also depend on how researchers count people who stop treatment. Only direct testing can show which drug is stronger. Weight loss percentages answer only one part of the comparison. Monthly dosing sounds easier than it may feel. A long-lasting drug cannot be quickly removed after injection. If nausea or vomiting begins, the medicine may keep affecting the body for weeks. Fewer injections do not automatically mean easier treatment. One difficult monthly dose may be worse than 4 tolerable weekly doses. Convenience matters only when the dose is predictable, effective, and manageable. The calendar cannot rescue a dose that makes daily life miserable. The trial shows why. Stomach and bowel side effects were the main reason treatment became difficult. Nausea and vomiting occurred most often around the first doses. Starting lower and increasing slowly reduced these events, but some participants still stopped treatment. The Phase 3 program therefore uses lower starting doses and gradual increases. This directly targets the early side effect problem. The goal is to preserve weight loss while reducing vomiting, dehydration, and unnecessary early treatment stops. Even with the dosing plan, MariTide remains investigational, meaning it is still being tested and is not an approved obesity medicine. Phase 2 can show a promising result, but Phase 3 must confirm benefits and risks in many more patients. Wegovy and Zepbound have approved dosing instructions, extensive safety records, and clinical experience. Their official labels describe specific warnings and treatment limits. MariTide cannot match that evidence simply because its first-year weight loss looks competitive. Approved medicines also have proven benefits beyond weight loss. Wegovy reduced heart attacks and strokes in adults with obesity and heart disease. Zepbound treats moderate to severe obstructive sleep apnea, repeated breathing pauses during sleep, in adults with obesity. MariTide is being studied for heart events, heart failure, sleep apnea, liver fat, and long-term weight maintenance. Those trials matter because losing weight is not the only goal. Treatment should also reduce the complications that make obesity dangerous. Larger Phase 3 trials must show whether weight loss lasts and side effects remain manageable for 72 weeks. They include people with and without type 2 diabetes and can reveal uncommon problems across countries. They will also test whether slower dose increase improve completion rates without weakening weight loss. A useful drug must produce weight loss with tolerable side effects. Heart protection may matter most for someone with heart disease. Better nighttime breathing may matter most for someone with sleep apnea. Insurance coverage determines whether treatment can continue. A monthly injection could help people who forget weekly doses, travel often, or dislike storing several pens. It could mean fewer injection days and fewer pens to carry. Those gains matter less if one dose causes weeks of symptoms. Weekly dosing has its own practical strength. The next dose can be delayed while symptoms are assessed. Clinicians can also change the plan sooner, rather than waiting through a full month before the next scheduled injection arrives. Longer intervals may become most valuable after major weight loss. Company-reported second-year results included people who had lost at least 15%. Many maintained that loss with a lower monthly dose or one dose every 3 months. These patients had already responded well. That selection matters because participants had already lost substantial weight and tolerated 1 year of monthly treatment. Their success cannot predict a new patient's response. Starting treatment may still require low doses and gradual monthly increases, so the every 3-month schedule does not apply to everyone. Another Phase 3 study is testing switches from weekly Wegovy or Zepbound to less frequent MariTide. It asks whether switching preserves weight control without restarting severe side effects. That evidence will matter more than comparisons built from separate trials. Until those results arrive, do not treat MariTide as a stronger monthly version of existing drugs. Its GIP action is opposite to Zepbound's, its dosing is different, and its long-term safety record is still developing. For someone doing well on Wegovy or Zepbound, a monthly schedule alone is not a reason to abandon effective treatment. Stable weight loss, controlled side effects, heart or sleep apnea benefits, and dependable coverage may outweigh injection frequency. For someone who cannot maintain weekly treatment, MariTide could eventually become a major option. If approved, it may fit someone who values fewer injections, struggles with weekly adherence, and can follow a slow dose increase plan. A monthly shot could genuinely change obesity treatment by reducing treatment burden and reshaping long-term maintenance. A monthly shot would matter most if Phase 3 confirms durable weight loss without harder-to-manage side effects from each long-lasting dose. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.